Hi students, welcome to oral pathology sessions. We are discussing about the developmental anomalies. Okay, so in the previous video we have seen developmental anomalies of your lip. Okay, and in this video we are going to see about your developmental anomalies of the tongue. Okay, so let's see developmental anomalies of the tongue. What are the developmental anomalies you can expect in a tongue? Okay, anomalies of tongue. Uh, you know, your tongue is the muscular organ in the oral cavity, and in certain people there is a condition where there is no tongue at all. Okay, so there is no development of tongue. That condition is called eglossia. So what do you mean by glossia? So we use the term eglossia, glossia. This glossia is a term something related to your tongue. Okay, so you may have heard about glossitis. Okay, means the infection, or sorry, the inflammation which is occurring on the tongue. We call it itis, glossitis, right? So eglossia means we have a complete absence of the tongue. Absence of the tongue. And if the tongue is smaller in size, we call the term microglossia. Microglossia. Microglossia is the what? Small tongue, right? A small tongue, or a reduction in the size of the tongue. These conditions, eglossias and microglossias, are seen in a condition called mandibulo limb hypogenesis. So this is a syndrome, or a condition called oromandibulolimb hypogenesis. In this, the oro part, there's a eglossia or microglossia of the patient. Okay, so this is what you see. This now, what if your tongue is large? What if the tongue is large? We call the term called macroglossia. So macroglossia is the term we use when the tongue is larger in size. Larger tongue. So what are the conditions where you can get a macroglossia? So you know that the tongue contains many soft tissues, right? The tongue contains your muscles, tongue contains your lymphatics, the tongue contains blood vessel, nerves. Okay, the tongue is made up of many structure. So any tumor arising in any part of this tongue, that will cause the tongue to enlarge, right? So if there is a defect with any of the content in the tongue, for example, if the muscle inside the tongue has some defect, or the lymphatic channels in the tongue has any defect, any blood vessel has a defect, what happens? This will affect the size of the tongue, right? So that is one condition. So we can see that the enlargement of the tongue can be either congenital, or we can be acquired also. Acquired. Congenital means any congenital malformation, example your vascular malformation, vascular malformations. Okay, any defect with the blood vessels. If the blood vessels are enlarging, your tongue will also enlarge. Okay, and your lymphatic problems, or lymphatic enlargements. Okay, any problem with your muscles, any muscle dystrophies, muscle hypertrophy. Okay, muscle hypertrophy or muscle dystrophies, hypertrophies. So when the muscle, if the muscle is having a hypertrophy, the tongue will also enlarge, because your tongue, most of the part of the tongue is made of this what muscles, right? Then any nerve related neurofibromas, all these conditions are can come congenitally. In the acquired conditions, you can see amyloidosis, a condition called amyloidosis. Now, amyloidosis is not a primary problem that affect with the tongue. Amyloidosis is due to some other systemic conditions. Right, means there is so much of amyloid being deposited in the soft tissues of the tongue. So that will cause the enlargement of the tongue. So amyloid, is a extracellular material that is deposited outside the cell. Okay, in within the tissues, it will is deposited, and the deposition of this amyloid, that condition is called amyloidosis. In that, the tongue will enlarge. Other conditions like your myxedema, acromegaly, okay, all these conditions, you can see your tongue is enlarged. But the important question in the NEET examination, they have asked about a syndrome, very famous syndrome which causes macroglossia. Okay, so that syndrome is called Beckwith Beckwith Wiedemann. So Beckwith Wiedemann syndrome is very important syndrome that the NEET people has. So it is very easy to remember. Back with wide man, wide man. Just remember wide man. Wide is something bigger, right? Wider, bigger, larger. Okay, so macroglossia. Back with Wiedemann syndrome. So in back with Wiedemann syndrome, you see macroglossia. Okay, it usually seen in children. Okay, it starts from the infancy stage itself. For the when the child is born, the child will be very gigantic. Okay, gigantism is in. That's why we call it wide man. Okay, so very easy to remember. If you relate and remember like this, wide man, what gigantism, macroglossia. Okay, and the person, the child will be having hyperglycemia. Okay, neonatal hyperglycemia. Okay, neonatal hyperglycemia. Back with Weidman syndrome. Okay, so this is very important question in your NEET examination. This is previously asked about Beckwith Weidman syndrome, and there is one another thing they may ask you is the type of this enlargement. Okay, type, how this tongue enlargement is seen, whether it is a diffuse enlargement, diffuse, smooth enlargement, means the tongue will appear very smooth and diffuse. That type of enlargement is seen in your back with Weidman. Back with Weidman. In back with Weidman, you see the tongue will be smooth and diffusely enlarged. Okay, but in a papillary enlargement, means it will look like finger-like projections or papillary like that type of enlargement is in your Down syndrome. Okay, in Down syndrome you can see that the tongue will be having projections, okay, papillary projections in there. Okay, and in certain condition you can see a multinodular enlargement. Multinodular, just like the tongue will be enlarged in nodules. Okay, such type of enlargement is seen in amyloidosis, also in your neurofibromas. Okay, so you can see that in this condition the tongue will have enlargement in the form of nodules. So read the question very carefully. Okay, so they may give you the type of enlargement: diffuse smooth enlargement, papillary enlargement, multinodular enlargement. Okay, a pebbly enlargement is seen in a condition called lymphangioma. A lymphangioma, say a condition called a lymphangioma, you can see pebbly type of enlargement. And from your common sense you can say that if enlargement is seen only in one side of the tongue, that is hemi or unilateral enlargement, can you guess the answer? In which condition we see unilateral enlargement? That is hemifacial hyperplasia. Hyperplasia, hemifacial hyperplasia. You can see one side of the tongue is enlarged and other side is not. Okay, so these are the different type of macroglossias. Okay, so read the question very carefully. They will ask you a question, a papillary type of enlargement or papillary type of macroglossia is seen in. Okay, so don't think that macroglossia is something related to Beckwith-Wiedemann and we will go for Beckwith. No, in Beckwith-Wiedemann it is smooth enlargement, and in Down syndrome it is papillary type of enlargement. So read the question very carefully. Okay, in this condition. Now, what is the next type of tongue anomaly? There is a condition called a geographic tongue. Okay. Geographic tongue. Geographic tongue, the term indicates geography. So hearing the term geographic tongue, you can resemble geography. In geography, we study about maps. Okay, in maps in geography, we study about the patterns. Okay, the land patterns, the maps, etc. There are other names of geographic tongue. It is called benign migratory glossitis. So this is one another term. Benign migratory glossitis means it is a migration of your glossitis. Glossitis is inflammation of tongue and it migrates. Migrates means it moves from one place to another. Means today the lesion will be on the tip of the tongue. Tomorrow, yeah, within 1 week you can see that that lesion will be on the center of the tongue. Okay, so it is migrating from one place to another and it is changing in its appearance. So we call it benign migratory glossitis. We call it geographic tongue. The other terms are erythema migrans, erythema migrants, okay, means it is migrating redness, okay, or we say wandering rash. All these are the terms which is denoting geographic tongue or benign migratory glossitis. Now what is exactly this? I will show you the image of this. Okay, this is actually a very good image based question in your NEET examination. Can you see this image? Okay, can you see the image? In this image you can see that there are certain white and red lines or white and red areas, right? So this portion you can see the redness, and in between you can see this white areas. Okay, so these are all looking like what geographic areas. You are looking like a land, a map like this, right? Okay, a piece of map, and this will also look like a map or a piece of map, right? So this presentation, the presentation that it is having, okay, so the presentation, how it is presented as, it is presented as a red areas along with white areas. The red areas are showing deep papillation, means there is no papilla there, that's why there is glossitis. Okay, so because of this glossitis the papilla is lost there. Okay, and that white areas, they are the what my the boundaries of this lesion. Okay, they are the boundaries of this lesion, and that is around this zone of erythema. Okay, zone of erythema, the redness is the redness, and along with that you have this white areas. Okay, so this is looking like a map actually, a geographic body. Okay, that's why we call it as a geographic tongue. So please remember this image. This is a image based question. IBQs we will discuss IBQ along with all the topics. Okay, IBQs are equally important. Image based questions are equally important. So we will discuss IBQs along with our syllabus. Okay, so what is exactly happening in this geographic tongue? So I hope the image is clear to you. Okay, now let's see what is happening in this benign migratory glossitis. Okay, now what is actually happening here? This is actually happening. This is occurring in the anterior two-third of the tongue. Mostly it comes in the anterior two-third of the tongue. It comes in the anterior two-third of the tongue, and this is usually asymptomatic. Asymptomatic. Now, it is very important. All these terms are very important. The clinical feature is very important because they give you the question: a patient present with asymptomatic, okay, redness on the tongue, okay, on the anterior two-third of the tongue, and it is demarcated by areas of redness. There is areas of redness where there is erythema. Okay, there's erythema, and even if there is redness, the patient is having no symptoms. She is having no burning sensation, no pain. Okay, that is made in the anterior two-third of the tongue, and this redness, the areas of redness is due to a loss of papilla. We say atrophy of papilla. There is atrophy of which papillae? It is filiform papillae. Okay, the filiform papillae is lost there. Okay, the filiform papillae is lost there, and you can see that there is a zone of this demarcation of this redness. Okay, and this condition, this is called your geographic tongue. Now if you take the histopathology, there's much no finding regarding the histopathology, but you can see that you can see some kind of some collection of neutrophils within the epithelium. Okay, so we can see there is neutrophils. Okay, these neutrophils are collected. Neutrophil collection is seen within epithelium. Yeah, the superficial epithelium will have some collection of neutrophils. You know this phenomena. This a phenomena. So always remember your epithelium, your mucosa or your superficial epithelium usually doesn't contain inflammatory cells. Okay, so inflammatory cells are seen in the connective tissue where you have blood supply, right? Where you have the blood supply, where you have the blood channels are there, blood vessels are there, there is the inflammatory cells. Okay, so in the superficial epithelium, where you see the stratum basale, stratum spinosum, granulosum, and your stratum corneum, there is there is no usual presentation of neutrophils. If neutrophils come to the superficial layers, it is unusual. So the phenomenon, okay, of this neutrophilic collection, okay, collection of neutrophils in the epithelium, we call it by a term. It is called Monro's abscess. Monro's abscess. Monro's abscess. So, if Monro's abscess is seen in a condition called psoriasis. 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 Okay, psoriasis. Monro's abscess is usually seen in psoriasis. Okay, the same phenomenon is seen in a geographic tongue. Okay, the psoriasis, psoriasis is a lesion or a disease of your skin actually. It is not a oral mucosal disease. A psoriasis is a skin disease. That is not an oral mucosal disease. But you see the same phenomenon of psoriasis in geographic tongue. So we call the geographic tongue by a term called psoriasiform mucositis. Okay, psoriasiform mucositis. Okay, so psoriasiform mucositis means it's look like a psoriasis only because of one thing, because the histologically they can show Monroe sepsis. Okay, no relation. There is no relation between psoriasis and geographic tongue. It is not a same disease. It is not a oral cavity manifestation of psoriasis. I don't think that psoriasis is a skin lesion. Why we call geographic tongue as psoriasiform mucositis? Because it has the same phenomenon of Monroe sepsis. Okay, so just that. Okay, nothing else. Okay, don't confuse or don't complicate things. It is so simple as that. Now we will see the next one, another tongue anomaly. So we have seen first one about the size of tongue. We have seen microglossia, glossia, and macroglossia, and we have seen geographic tongue. There is one another anomaly. It is called median rhomboid glossitis. Median rhomboid glossitis. Now, actually, median rhomboid glossitis is not a developmental anomaly. In previous time, we have thought that median rhomboid glossitis is a developmental anomaly. Please listen very carefully, because you can see that median rhomboid glossitis in older textbook, even in your Schaeffer's, I think it is discussed along with the your developmental anomaly of the tongue. But it is a old concept. Now, what is median? What is rhomboid? What is glossitis? So pathology will explain itself by its name. Okay, I always prefer that. But pathology, what he does it, I will explain. I am median, I am rhomboid, I am glossitis. So in the mid portion of the tongue. Okay, so we have the tongue here. Okay, we have the tongue. This is the anterior 2/3, and this is the posterior 1/3. Now, at the junction of this anterior 2/3 and posterior 1/3, now what I am drawing is that there is a diamond shaped area. Okay, there's a diamond shaped lesion, or is a rhombus shaped. Okay, in the mid part, in the midline, in the middle portion, in the shape of a rhombus, in the rhombus, we have glossitis. Okay, so this is median rhomboid glossitis. So glossitis means in this area there will be atrophy of the papillae. There will be atrophy of your filiform papillae. Okay, atrophy of your to the side. Okay, so atrophy of your filiform papillae is seen in this area. Okay, though in the previous time it was believed that this is due to a problem with the fusion, problem in the fusion of this posterior 2/3 and anterior 1/3. Sorry, anterior 2/3 and posterior 1/3, where your lingual swellings and the tuberculum impar fuse, right? So while the fusion, some kind of developmental anomaly took place there, and there is no papillae in that area. That's why this rhombus shaped glossitis has come there. But this is an old concept. Okay, so old concept is that there is a defect. Okay, that is defect that is due to a failure of fusion, or it's a fusion defect between the lingual swellings. The tongue originates from the lingual swellings and the tuberculum impar, right? Tuberculum impar. So this is the old concept. Now the new concept, what is the new concept? Please remember, the new concept is seen in many of the latest question papers. Okay, new concept is seen in many of the question papers. Now, new concept, we say that this is not a developmental anomaly. This is just a fungal infection. It's just a fungal infection. Okay, so new concept is that it is fungal infection. Which fungus? Candida. Okay, your candidiasis. It is a candida infection. Okay, candidiasis. It is called posterior median atrophic candidiasis. Okay, This is a new term for it: posterior median atrophic candidiasis. Okay, this is seen in your newer textbooks of Neville. Okay, in Neville, you can see that in the chapters of fungal infection in the Canada, they have explained it very well. Okay, so that's a new concept. Please remember, it is a fungal infection. It is posterior median atrophic candidiasis. Okay, so this is about the next of tongue anomaly, and one more tongue anomaly. Let us see. There's a tongue anomaly called fissured tongue. Fissured tongue, what you see in the fissured tongue means on the tongue you are seeing so much of fissures. Okay, so many fissures are seen. Nothing much important. There is one syndrome we should remember, which is associated with fissured tongue. So in some patients they have fissured tongue, and the patient will have a lip anomaly called cheilitis granulomatosa. Cheilitis granulomatosa, and the person will have facial palsy. Okay, facial nerve palsy. So the triad of this, the patient having a triad: fissured tongue, cheilitis granulomatosa, and facial palsy. Okay, and that triad is called Merkerson-Rosendahl syndrome. Okay, Merkerson-Rosendahl. Merkerson-Rosendahl syndrome. So this is one anomaly called Merkerson-Rosendahl syndrome. You may get a question, direct question, what is fissured tongue with the cheilitis granulomatosa and facial nerve palsy. Okay, so that is it. Now, one last one, that is, you may have heard about a term called ankylosing. Ankylosing. Now, what is ankylosing? Ankylosing, the simple term, it is tongue tie. Tongue tie means you have a lingual frenum which connects your tongue. So you can feel your lingual frenum if you go look in the mirror, raise your tongue and see. You can see a mucus membrane, a thin frenum that connects your tongue with the floor of mouth. That is your tongue, your lingual frenum. Okay, it is called a lingual frenum. So the lingual frenum, if it is attached more towards your tip of tongue, we call it tongue tie, because the tongue will lose its movements. Okay, the frenum controls the movement, and if the tongue frenum is attached more towards the tongue tip, the person cannot move the tongue much freely. Okay, so it is looking like a tongue is being tied to the floor of the mouth. Okay, so it is called a tongue tie. Okay, tongue tie, lingual frenum, and that condition is called ankyloglossia. So tongue tie means the lingual frenum attached to the tip of the tongue. Okay, attached till a tip of tongue. It is called tongue tie. Now, why I am saying is that because there are two terms which the NEET people has used in the question. That is called, one is classification of tongue tie. That the classification of tongue tie is done by a classification called Kotlow classification. Okay, that is not important. You should go in detail about Kotlow classification. It shows the severity. It shows the severity of ankylosing. Means how severe the ankylosing is. So mild, moderate, or severe. That is Kotlow classification. So the assessment used to classify the severity of tongue tie, that is called Kotlow's classification. Okay, that is Kotlow's classification. While to assess whether the patient needs a surgery or not. Okay, so the patient has a tongue tie. We are assessing the severity that by Kotlow classification, and whether we have to do a surgery in this patient. So treatment planning. For that we use another tool that is called a Hazelbacker assessment tool. The Hazelbacker assessment tool, that is for the deciding the treatment. Deciding treatment. Okay, so this much is there, nothing much. So we have discussed about your microglossia, macroglossia. Okay, and the other one is your geographic tongue. Okay, median rhomboid glossitis, and finally the ankyloglossia. Okay, so this is about the developmental anomalies of the tongue. Okay, hope you understood what are the different developmental anomalies of the tongue. Okay, see you in the next class with the next topic. Thank you.